Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, we're back for the last segment, and I have Marvin on the phone. Marvin?
Yes, I'm still here.
Yep, you had another question?
No, I wanted to inform you of what you said about Medicare. Doesn't cover that laser surgery?
Yeah, it does for some. I just don't think it covers it for the spine.
Well, did you know, me having senior dementia, Medicare doesn't exist?
Correct. And senior dimensions will not approve it at all.
Yeah. See, if I don't get it through you or VA, I can't have it anyway. And
No.
VA hasn't done anything about it.
And the VA may not do anything about it. VA is not going to be in a position where they're going to operate on you and probably put you in worse conditions. And that's the risk you take with back surgery in general, is that the scar tissue will actually cause as much damage as the original injury will itself. So, and as you get weaker over time, your rehabilitative properties tend to be poor. So therefore, your body kind of melds to the degenerative disc disease that you have. And so when you get a new back or you do surgery, the muscles really aren't there to really support the surgery. So it kind of lapses back to where it is before, plus scar tissue can come in and grab the nerve and and scar tissue contracts. And it's an unrelenting contraction. That's what scar tissue does. So sometimes people get immediate pain relief only to find scar tissue from bleeding and things of that nature that come in there and they grab the nerves and squeeze them down, and therefore you're getting more pain or your pain returns. That's why you have to be able to rehabilitate yourself and stretch that tissue and being able to work it in there after surgery. It's so important. Which is part of what Creig talks about a lot, which is just keeping mobile and using as little pain medication as you need to allow yourself to be mobile. Because pain medication, when it wears off, actually causes more pain. Yeah. So you're caught between the proverbial rock and a hard place, Marvin. There's no way around it. And for the promise of any cure, also comes the promise of worsening conditions. And that's why it's so important for you to, let surgery be your last option of last options of last options. And maybe time and science will invent something, and maybe laser surgery. Laser surgery is supposedly, the reason it's so successful is because it controls bleeding at the same time it removes the tissue. So therefore, you have less bleeding and less chance for scar tissue, less chance for infection. And that's why laser surgery is so, quote unquote, in vogue. Whether or not it works in this condition, who knows? And it's all in the basis of the surgeon and who's doing the surgery and what his outcomes are. It's a crapshoot, Marvin.
Yeah, well, that's my last resort is back surgery or dying. And so I think I don't want to have back surgery. I had a friend in the 70s, and he still hasn't recovered from surgery. So
Well,
Very common.
yeah, very common. And then the insanity of it is people go back for second and third surgeries. Now that I don't understand.
yeah, well, I don't even want to go the first time.
Yeah.
But like I was going to say to you when we went to break, I guess I go back to Reiner and get some more morphine if I run out of that. But she gave it to me, I think, more than a year ago, 15 milligram, because it's something that I can take and handle. And I don't ask for any kind of prescription, knowing that I can't handle it. It was, I asked her about 30 milligram, and she said that was very hard to come up with because of inspections or whatever you guys go through, and would I accept the 15? And I did. Now, this has been over a year ago from what I can remember, and I've only taken 2 in that time, and that was, the last time I took one was last year, before January.
Well, and that's the best approach, is to take as little as possible to relieve your pain. I mean, that's the whole object behind it. But I don't know what she said about coming hard to come by. I think you just don't want to get yourselves on a high dose of opioid, which is going to make sure that you continue to take a high dose of opioid. And I haven't been on my opioid rant in a long time, but I'm going to tell you what Walmart did recently. We got a few minutes left.
Yeah, you're doing it.
And I'm going to digress for a second, Marvin, because I've been away. Either I've been doing Beatty on Monday night, trying to get the nurse practitioner ready, which I haven't been there.
Well, let me answer to that one.
And Creig has been taking the show.
You said, please.
What's that?
Let me say what about that hard to come by. That wasn't a hard to come by. It's something that is some kind of restriction. That 30 milligram is for somebody that's very bad shape of cancer or something like that, is what she was saying.
Well, that's hogwash. That's basically, if you need to take 30 milligrams, it's because you need to take 30 milligrams. There is
Well, that's what Renee told me. She works in your office.
No, I know that. I'm just saying, I just 30 milligrams of morphine twice a day is a big dosage, and you don't start out with that dosage.
No, I never did take that. I mean,
Right.
I had 30 milligram way back in when I came here in '98 from a nurse practitioner in the service.
Right. It's all based on what your body is tolerant to, on far as opioids. But
Yeah, well, I don't like to get goofy, and that's
no, that's true. That's
makes
true.
me goofy, and that's why I don't take it.
Okay. No, I agree. You shouldn't start out with that much, and you shouldn't continue with that much.
Yeah, well, I'm goofy now. But anyway, go ahead and say what you were going to say.
Well, I'm just saying that Walmart, they had this new pharmacist at Walmart, and they were unilaterally telling patients that they could only fill 120 of their opioids.
We had a question about this earlier
Yeah,
tonight.
and it's just insane. They weren't calling the doctor. They were just saying, well, we're just only going to fill 120, and that's just all they were going to do. That's all we're going to do. They never called us. They never called the doctor. So to my viewing audience, if you were a victim of this so-called unilateral reduction in your opioid dosages, you should be calling the State Board of Pharmacy and registering a complaint against the pharmacist at Walmart. That is breaking the law. The pharmacist cannot do that. Her reason and rationale was because they were running out and they were just going to ration it for you without speaking to the doctor. That means she changed the number on the prescription without getting the authorization to do so from the doctor.
Practicing medicine without a license.
Practicing medicine without a license. Pharmacists have the ability to dispense. They do not have the ability to prescribe. And so we have to remember that. And so if you're out there and that happened to you, please call the State Board of Pharmacy. I mean, they just can't allow this crap to keep going on. And I had several patients do it. I'm waiting for them to write the letter so I can substantiate the complaints I'm going to make to the pharmacy board. But this crap has got to stop. I mean, and your poor patients. So I'm trying to reduce the opioids for my patients because it is basically an immovable object. I mean, The corporate monster is limiting the amount of pills they're filling in every pharmacy. You are going to run out. So, you know, as a population in this town with 3 or 4 big pharmacy chains, you're only going to get so many opioids coming into this town per month. And
what Reiner did was drop me to 15 milligrams, said if you need 30, take 2.
Right.
Well, yeah, that made sense to me, but I appreciate her saying 15 because I took a 15 one day, and I didn't have to take it for another one. I think for about 2 weeks later, it was I took another one. So I don't get into the 30 milligram if I don't have to, because like I think I had once said to you, I took a 30, went out outside and walked around, and I got goofier than hell.
Well, there should be no reason for you to take a 30 if you're not used to it.
Well, I mean,
No reason to take a
any
30
of it,
at
'cause
15
I'm not
works.
used to it.
Yeah, I mean, it's just too much medication all at once.
Anyway, I'm going to get off the phone, and sorry I took up so much of your time, but I appreciate your information.
Yeah, you're welcome.
The one person that's sitting next to you there, he works over there at that by the clinic, VA clinic, and that chiropractor.
Yeah.
Okay, I think I might need to go over there and see him anyway. Am I covered under senior dimension if I
Not
come
yet.
see you?
Not yet. We're working on that.
Okay, then I would have to pay you.
Yeah.
I don't got no money. I'll have to pay you in almonds or something. There's an almond field. Okay,
Alrighty.
well, anyway, guys, have a nice rest of the week. Take care of yourselves.
We
Thanks,
will.
Marvin.
Well, Marvin.
Feel better.
And so anyway,
Yeah, we had a question. I think Chuck called in earlier about that. And again, it's your expertise. But I remember how hot you got the last time we talked about the pharmacist altering your prescriptions,
Yeah.
altering the number, and
yeah, this is against the law. So with that, we have to close the show for tonight. I'm glad I could come back.
thank you, Pahrump.
And we'll see you next week.